rhinitis affects mainly the nasal cavity, not the sinuses, okay? And it's actually a misnomer. It's very rare that you have pure rhinitis, and it's very rare that you have pure sinusitis. Life is full of spectrums. Light, white light has got many different colors. And I do a lot of sleep apnea surgery, and the sleep apnea is, again, there's a spectrum. So if you're around long enough, you see the spectrums in a lot of different things. Rhinitis is the early spectrum of an inflammatory process inside the nasal cavity. Sinusitis is one of the end results that when you've gone through the rhinitis, it affects the openings of the sinuses, and that's when you start having the pressure, the pain, the discomfort, the chronic fatigue. And what we now use, because a lot of times when we see somebody, if we haven't done the x-rays, if we haven't done the rigid nasal endoscopies, where we actually take a look inside your nasal cavity with a scope and take pictures in the clinic, we can't really tell you what you have unless you've done those things. And so the real proper term that family practitioners should use in other primary care is a rhinosinusitis, because it's more of a spectrum. You may have more of the rhinitis than the sinusitis. When you catch a viral syndrome, it starts out more like a rhinitis, but it can go into a rhinosinusitis, and it can end into a chronic sinusitis. And not everyone does. Most of them will back up. Again, if you wash out the viral load, if you wash out the irritants. So I suspect that the reason why your physician mentioned the term rhinitis was that there was an inflammatory process inside the nasal cavity, which is mainly what we call the pre-filters. And so if you can open up those pre-filters and wash them and clean them, you'll actually do a lot better. I'll use the analogy of a vacuum cleaner, a HEPA vacuum cleaner. There's something called a pre-filter. And pre-filter takes out the bigger particles so that the more expensive filter, which is the HEPA filter, doesn't get plugged up. You have to change your pre-filter a lot more frequently than you have to change your HEPA filter. So rhinitis can be viral infections, it can be chronic infections from fungus, it can be hay fever, allergies, that's another form of rhinitis. So it just means an inflammatory process, not always infectious. And it can actually be autoimmune, it can be tumors. Any other questions?
I was just wondering that the lady on the screen was saying that this is all very close to the brain and eyes and so forth.
Right.
And I have, I'm on medication for glaucoma. I don't have it, but a suspect because of the high pressure.
Okay.
Would that come into play in that treatment?
Typically not. It depends upon if you have glaucoma, if you actually have closed angle or open angle glaucoma, because there's a difference, and it has to do with what we call the canalish slim, which is where the aqueous humors drain. And I'm not an ophthalmologist, but I know about it. One thing that glaucoma can do is it can mimic the pain of a sinus infection. Okay, and so if your intraocular pressures are high, you can have pain that may be in the ethmoid area. Part of that is because a lot of people don't realize this, so I'm going to digress and just kind of go forward again. The body is not as well equipped on the inside as it is on the outside with regards to gathering information of its environment. Your hands are very sensitive. When you want to feel something, you're getting a lot of information. You have a lot of discrimination within your hands, the back of the hands, the fingertips, your lips. If you put a fine tip pin very close to each other, you can discern two separate points. If you put two separate pins on your back, it could be 5 centimeters apart before you can tell if it's really 1 or 2 pins. Inside your body is similar because the neural network that's spent on the outside of your body, because you're trying to avoid toxins, you're trying to avoid noxious stimulus, is much better than inside. So inside, we probably have heard of people that have had pain in their, or had heart attacks, but they had pain in their jaw, pain in the neck, pain in their arm. They don't have a heart in their neck. They don't have a heart in their arm. What's happening is they're getting what's called referred pain. And referred pain is that all that network that's not really well defined and very specific to one area is getting funneled into the brain and interpreted as coming from a wrong place. So with regards to sinuses, it may be that there's a sinus issue. It may be that there's not a sinus issue. It might be a problem with your pressures. One way to take a look at that would be to certainly take a look inside your nasal cavity, CT scan of the sinuses to see if there's really a problem with regards to that. As far as the technology is concerned, for treating sinus problems, if it's not related to the glaucoma, there's no contraindications with regards to that. So I know that was a long answer to your question, but I had to spout it out a little bit.
How does the problem in all of the sinus cavities?
You can use it in the frontal, the maxillary, and the sphenoids as described here. It's a little different in the ethmoids. And the ethmoids are the ones that are between the eyes. And I typically, personally, don't use it for the ethmoids. I think it's great for the frontal sinuses. I think it's much safer than other conventional techniques for the frontal sinuses. I think it's very good for the sphenoid sinus. I think it's very good for the maxillary sinuses. I don't think this technology is the greatest for the ethmoids at this point in time. Okay, so again, the number one thing is that you have to take care of what the patient needs. Having said that, let me digress a little bit. When I get back to functional endoscopic sinus surgery, what you want to do is open up the plug. And I'm going to use another analogy. I'm going to use the analogy of rain gutters. If your rain gutters are constantly getting filled with leaves, and you're not able to get the water to come down your rain gutters appropriately, you don't just tear down your rain gutters. What you try and do is you clean them out. And usually there's a plug of leaves that are there. Okay. So what you do is you're functionally looking at where the plug of leaves are, you clean that out, and then hopefully your rain gutters will work fine. However, if you don't take care of the branches of the trees that are spilling leaves into the rain gutters, you're going to have the problem over and over again. Okay. So one thing that we've realized is that there are rain gutters, if you will, the key blockage points. So I wanted you to use that analogy. One of them is for the frontal sinuses and the anterior 2/3 of the ethmoid sinuses and the maxillary sinuses. They drain into an area that's called the ostomeatal complex unit. And the studies are starting to show that if you drain the ostomeatal complex unit, a lot of times the anterior 2/3 of the ethmoids over time will regress and improve. Again, because you've taken care of that key block area. There's another area that's called the sphenoethmoid recess. So this posterior third of the ethmoids and this sphenoid sinus, there's this sphenoethmoid recess in this area. If that is open, that has a chance of not only clearing the frontal sinuses, but the other posterior third of the sinuses. So there's studies that are starting to come out showing that this is, in fact, what's happening. But I wouldn't say that all the information is there yet. So I don't think that you necessarily need to use this technology in the ethmoids where you actually put a delivery system for some medication into the ethmoids. That's just my personal belief at this point in time. But once data comes out and there's more information to show that maybe that's what you need to do and it's safe and effective, then I would. But at this point, there's a lot of data showing that if you can get those clogged areas, then over time, the rest of the sinuses will clear. I hope that answered your question. Sir?
But if you open them, what's to stop them from filling leaves?
Excellent question. You get the prize. Again, I'm going to use the analogy of the rain gutter. If you get tired of your rain gutter getting plugged, what do? You cut down the trees and the branches so that they don't keep filling. Now, that means that there's a certain amount of responsibility that has to be taken care of. So when I tell patients if they need sinus surgery, I tell them from my point of view, from my opinion, from my experiences, anybody who tells you that sinus surgery will solve all your problems is lying to you. That's my personal opinion. Okay. I tell them that from my personal opinion, my personal experiences, that the blockage is taken care of. So that's the structural problem. But there's still the physiological problems that have to be taken care of. Okay? So if there's an infection, you got to take care of the infection. If there's an allergy, you have to take care of the allergy. So depending upon what's going on, really depends upon what's necessary that needs to be done. Benjamin was in a case with me last week. The patient had a fungal wall actually in the sinus. And so I could open up the sinus and it was perfectly open and it could drain, but the fungal wall can't come out. So I've still got to get that out even though the drain has been open. So again, there's the physiological other issues besides the structural issues. And so to me, it's incumbent upon the physician and the patient to discuss the physiological issues to try and prevent those from coming back. Another excellent point that I want to bring out is smoking. Is that's basically like throwing leaves into the area. A lot of studies have shown that if you smoke and you have surgery, then there's much more inflammatory process that's occurring. So there's the rhinitis and the sinusitis from the chemicals that are from the smoke. And so I tell patients that smoke that I can open things up, but you have a higher instance of it coming back. Okay? And also, there's also responsibility of keeping it open. And so I usually have my patients, after they've had surgery, use a sinus rinse, a saline rinse. And even with the balloons, I have them use the saline rinse. The idea before was you would prevent the crusting from forming because there was exposed bone, and so you could debride less, and the patients would not have the blockage. But I think that even with something that's as gentle as this, if you're around the inflammatory processes, if you can wash it out with something just like the saline solution, I typically recommend over-the-counter Neomed solution. They have a high volume, low pressure system that just washes things out, and it's isotonic, which means it's non-disturbing to the mucosa. It's got the same amount of saline in your cells as it's in the solution, so it's not drawing anything in or drawing anything out. So again, there is a prevention that I think is also required once the structural problems have been taken care of. I hope that answers your question.
I have another.
Sure.
How does this in any way relate to sleep apnea?
It does. It does. Directly and indirectly. When I assess a patient for sleep apnea, as I said before, many things as you're old enough and experienced enough in something is a spectrum. So there's light snoring, and then there's severe obstructive sleep apnea. The nose is one of the areas that allows you to bring air in. Okay? If your nose is not working very well to bring the air in, then what happens is you typically open your mouth. When you open up your mouth, what typically happens is you narrow the space, you increase the Bernoulli's principle effect, and so you have more vacuum suction, and then what happens is you turn the soft palate into the reed like that of a clarinet. And so that's where the sweet sound of snoring comes from. And so what you have to do is you have to either affect the chamber or you have to affect the reed. And so one of the ways to affect the chamber in the flow to decrease the Bernoulli's effect from the vacuum from going through a small space is increasing the amount that you can breathe through your nose. Now that's not directly from the sinuses itself, but again, going back on the analogy of the spectrum of rhinosinusitis, you have to take care of the rhinitis, make sure that your turbinates, what we call the inferior turbinates, are open, make sure that there's not a lot of significant problems with the septum, so that there's a nice, good laminar flow, so that you can actually have good intake, and so that there's not so much Bernoulli's effect on the soft palate, which causes it to vibrate into a resonance that the human ear can hear.